Phew. Okay. Some of these slides are going to be repeats, which is good, right? You'll have seen them already. Okay, like this one here. Psoas major. Okay. Psoas major, this is found in the lumbar spine. Okay, goes down into the pelvic cavity there. And it's going to fuse with another muscle. So this is psoas major. I don't know, what page is this on? 38. Okay. There, and here's another viewing of psoas major right here. Is this 44? No, it's not. Darn. I was right. Sweet. I totally guessed on that. The only other page number that I could think of. All right, so there's psoas major here. Okay. All right. So now let's bring in a second player, which you've already labeled. Okay. It's the muscle that lives in the iliac fossa. That's Iliacus. Okay. So the iliac fossa is found on the anterior part of the os coxa, or the innominate bone there. Okay. And then going back to page 44, you'll see it here. All right. So there's a reason why I'm showing you both these muscles, because they both fuse together to form Iliopsoas. So on this slide here, okay, you've got this ligament right here called the inguinal ligament. Okay, so below the inguinal ligament, right, it's referred to as Iliopsoas. Above the inguinal ligament, right, this is psoas major and iliacus. Below it, you've got Iliopsoas. It's the most powerful hip flexor. Okay, that means that is you bringing your knee up towards your chest. That is hip flexion. Okay. You don't need to know this, but I'm going to point it out to you anyways because I'm an anatomy teacher and that's what I do. What I'm circling here, right, are three structures. Okay. One's blue, one's red, and the other one's yellow. Well, we can figure out what the blue and the red ones are. Those are blood vessels. Okay. And the yellow is a nerve. Okay. And this is nice because they're all the same name. They just have different last names. They're femoral. So this is the femoral vein, this is the femoral artery, and this is the femoral nerve. They would call it the VAN, V-A-N, vein, artery, nerve, starting with the medial, going to the lateral. Femoral vein, femoral artery, femoral nerve. Okay? Just wanted to point that out because I'll be using that as an anatomical landmark. If you hear me say it's medial to the VAN, you know, all right, it's on the inside of the leg. If it's lateral to the VAN, either anterior or lateral on the leg. Okay, so just more for me than you. All right. Okay. So clear that out. So this is Iliopsoas. Okay. So now what we're going to do is we're going to turn the model to the side here. All right. And here is our Gluteus Maximus muscle. Again, gluteus because that's the location of it. It's in the gluteal region. Maximus because it's a big muscle. All right. So that's this whole thing right here. That's Gluteus Maximus. Gluteus Maximus muscle helps you to extend your leg. So kicking your leg backwards. People, there's two nerves that will innervate this muscle. Anyways, point being is, if someone ever says that they're having difficulty walking upstairs, all right, most likely they're having an issue with the Gluteus Maximus muscle. It can be because of one or both of those nerves, but it could be a low back injury too that could be causing that, right? So that's one of the things people complain of. Oh, I'm having trouble climbing the stairs. They just feel weak. They can't get the power to do it. Start thinking Gluteus Maximus. All right, turning it to the side here, okay? Does anyone know what page this is on? 33. You heard it here first. All right, then there's one more model. I don't know what page this one's on here, but you can see it right there. 39. Thank you. All right. Here's the gluteus maximus muscle. Okay. So there's two smaller muscles in the gluteal region. There's gluteus medius and then gluteus minimus. You don't have to know gluteus minimus, but you do have to know gluteus medius. Okay, that's this one right here. Okay, gluteus medius is very similar to the deltoid. What deltoid does for your shoulder, gluteus medius likes to do for your hip. It's an AB abductor. Okay? It does a little bit of hip extension. You can find probably the biggest bodybuilder. There I go again with the bodybuilding thing. But you will find that most people that work out and exercise have a weak gluteus medius. There's a test called the Trendelenburg test. What gluteus medius does is when you're standing up, okay, and if I were to lift one of my legs completely off the floor, right, gluteus medius immediately engages to keep your hips from going like this, okay? So if you have a weak gluteus medius, okay, then you would see that. Like when I say weak, it would be really, really weak. There's another test that you can do to test it, right? But like pathologically weak, meaning, all right, you've got some nerve damage there or some muscle damage going on, right? But that's called the Trendelenburg test because normally your hip should be balanced when you lift one leg off. But if the hip sags, right, to one side, if I lift my right leg off the ground and my hip sags on the right side, all right, I have a weak left medius. All right, something's going on with that. All right, here it is on this model. All right, and then one more model, page 39, I believe. No, that's not 39. Is it 39? Lucky. All right, that's this whole muscle right here. All right, gluteus medius. All right, one of my favorite muscles. Sometimes when people have issues with their sciatic nerve, it's not because there's it's because there is something wrong with the sciatic nerve, but it's not that there's a disc herniation going on or something. It could be muscle related. It's because of this muscle here. That's called the piriformis muscle. If you see the piriformis muscle, you'll see a nerve right below it, and that's called the sciatic nerve. So if the piriformis muscle hypertrophies, okay, or goes into spasm, it can press on the sciatic nerve and give you sciatic nerve, sciatica type of symptoms. I believe in less than 1% of the population, the sciatic nerve will actually pierce through the muscle belly of piriformis. That's the problem. Right? Very small percentage of people, right, have that issue going on. And I'm assuming that nobody in this room has that problem going on, because you know it. All right, here's piriformis on this model. So again, if you're taking this test and you see, all right, this arrow's pointing to this muscle here, look to see where look to see where the sciatic nerve is. The sciatic nerve is adjacent to the muscle, then you know it's piriformis. My father had piriformis syndrome. A lot of physical therapy, a lot of chiropractic work, and exercise. All right, this next structure is not a muscle. Okay? This is known as the Iliotibial Tract. As you can see, it's not red, so it's not a muscle. Okay? You may have heard it as the IT band. Don't write that on your test. That is wrong. It won't be wrong, but it will be wrong for us. Okay? You need to know it as the Iliotibial Tract. Okay? So the iliotibial tract is a really interesting structure. It's made of connective tissue, and it actually will attach to and fuse onto your knee capsule. So what we found out that people that have issues with this muscle here, right, or having issues with the iliotibial tract can have knee pain. So sometimes the problem isn't in the actual knee. So the name of this muscle makes me think of Starbucks. This is the tensor fascia latae muscle. Okay, sits on the front lateral side portion of your lower extremity there. Okay, it helps to flex the hip a little bit, and it does a little bit of internal rotation of the hip and some abduction. Right? That's the tensor fascia latae, and you can see this muscle attaches here onto the iliotibial tract. All right, moving on. All right, now we're going medial to the van. Okay, this is the anterior view. This little guy right here, tiny, tiny little muscle. Okay, that's called Pectineus. So lateral to the van, where I'm putting the X, that's your Iliopsoas muscle. Medial to the van is the Pectineus muscle. The little fella right there. Okay, now we're going to go medial to Pectineus. And then you got this muscle here, Adductor Longus. What do you think this muscle does? That's right. It's a hip adductor. Okay, so if you bring your leg out away from your body and you return it back to the midline, you're using your Adductor Longus muscle to help with that. So that's this guy right here. Okay, Adductor Longus. Now, all I'm going to do is, same muscle, okay? I'm just going to look at it from the medial side, from the inside of your leg. Okay? There you can see it, and really nice. Adductor Longus. All right, there is an adductor brevis, but you don't need to know it for identification purposes for our class, okay? Don't want to confuse you. Anyone know what this muscle here is? That's right. Good job. Good. All right. Now we're going to go to stay on the same view, but we're going to go to the back all the way. Right? You got this muscle here that is called Adductor Magnus. Right? So again, you can already figure out what this muscle is going to do. Adductor Magnus is its main primary action is to adduct, but it also will help to extend the hip. Okay, but because it's on the back side of the leg, but its primary muscle action is adduction. All right, now there's a muscle in between Adductor Magnus and Adductor Longus, and that's gracilis. So the muscle in front of it and the muscle behind it both start with adductor in their names. Gracilis is all by itself. Okay, now I'm going to show you the longest muscle in the body. Does anyone know what it is? Are you shaking with anticipation? Because there's a song associated with it. I'll sing it for you. Sartorius. I don't know. It's supposed to be, you guys know what I'm talking about. Don't pretend like you don't know. That's right. Larry, that's right. It was Sartorius. That's the longest muscle in the body. Okay? Sartorius. So here you can see, all right, Sartorius is going to be lateral to the van. All right, it's going to be lateral to Iliopsoas. All right, it attaches here onto this part of your os coxa That is the anterior superior iliac spine, by the way. All right. So Sartorius, it goes from the outside of your leg. I'm going to show you another view for it. Okay, we're going to look at it from the medial view. Check it out. It goes from the outside of your leg and it crosses over to the inside of your knee. Okay, longus muscle. And it helps you to make the figure 4 position. When you bend your knee, okay, and then you ever sat with your ankle on your other knee, okay, like you read a newspaper like this. That's how it is. For you folks at home, this is what I'm doing. Can you see me? My knee is crossed. This is Sartorius. It's causing me to do that. Okay. All right. Let's see. Okay. Now we're going to go to the anterior compartment. And I didn't talk to you guys about the different compartments of the thigh. There are 4 compartments. There's an anterior compartment, posterior compartment, a medial, and a lateral compartment. Okay. We just did all the muscles of the, well, not all, but all those muscles we just did were from the medial compartment. Now we're going to go to the anterior compartment, everything that's on the front of your thigh. All right, and those are known as your that's known as your quadriceps muscle group, okay, on the anterior portion of your thigh. So the first one is called the rectus femoris or femoris muscle. The most anterior muscle, right, and the anterior muscle group of the quadriceps. Rectus femoris. Now listen, for me, when you're taking the test, you don't have to write rectus femoris muscle of the quadriceps. Just write rectus femoris M period. Okay, be good. If you want to write it out of the quadriceps, feel free. Okay, or I'm sorry, type it out. Type it, okay? All right. So now we're going to show it to you on the anterior view. Okay, there you can see it. It's right there, front and center, right in the middle. It is the rectus femoris muscle. Now all I'm going to do is I'm going to spin our model to the side and show it to you from the lateral view. Here it is from the lateral view. Okay, you can't see a lot of it. Okay, this is where it is. Everything to the left of that blue line. It's the rectus femoris muscle. You can see it from 3 different views possibly. Okay, medial view, anterior view, lateral view. All right, let's go to the next muscle in the quadriceps muscle group. We're going to go back to the medial view here, and this is going to be the vastus, makes sense to call it this, vastus medialis, okay? Because it is found on the medial side, right, of your leg. This is one of the muscles that gives you that teardrop appearance, okay? When people are contracting the quadriceps. Well, now I'm going to just spin it here so we can look at it from the anterior view. Okay, here's vastus medialis on the medial view. Now here's vastus medialis on the anterior view. Okay, this is medial, this is lateral. All right. Now in this dissection here, we're missing a muscle. We've dissected out rectus femoris. It's not here. Okay, so we'll put it back. There we go. I know that some of you are worried. What happened to rectus femoris? Don't worry. Put it back for you. All right, so there's vastus medialis. All right, so we saw vastus medialis. Now let me introduce you to our friend vastus lateralis. Okay, that's the muscle, the quadriceps muscle on the lateral side of your knee or the lateral side of your thigh. Again, this model, we're missing rectus femoris. So let's replace it. There you go. There's vastus lateralis. All right, and then all I'm going to do is I'm just going to turn the model so we can see it from the lateral view, and so you can see vastus lateralis from the lateral view. Okay, There's Vastus Lateralis sandwiched in between the Iliotibial Tract and Rectus Femoris. All right, there's one more muscle in our quadriceps. Okay, what we're going to do is we're going to remove Rectus Femoris, and there's a muscle that sits deep to Rectus Femoris, and that is our Vastus Intermedius. Okay, it sits right below the Rectus Femoris. Well, it's just because that tendon, that aponeurosis, is just, here's the muscle itself, like the muscular portion of it goes up here. Okay. But yeah, that muscle has that thin aponeurosis there. Okay, so that's it for the anterior compartment. Now we're going to go to the posterior compartment. We all know what's back there, hamstrings. Okay, so let's take a peek. There's only 3 of them that we need to know. This is lateral, this is medial. Okay, so the muscle here is the most lateral. It's the biceps femoris muscle. Again, you don't have to write out biceps femoris muscle of the hamstrings. I'll be fine with biceps femoris M period. Cool. Okay. Biceps femoris is the most lateral, right, hamstring muscle. Okay. In fact, its tendon is going to insert on the lateral portion here of your knee capsule. All right. So we're going to go more medial now. Well, okay. Here's the biceps femoris from the lateral view. Just posterior behind the iliotibial tract. All right, and then we'll go back to the hamstrings. This is semitendinosus muscle. Now here's the thing. I will outline it for you because semitendinosus sits on top of partially another muscle. So here's the semitendinosus muscle. As best as I can. Oh, that's not bad. All right. All right, that's semitendinosus. So it sits on, all right, the other hamstrings muscle. All right, so you notice this slide only has one arrow, okay? But it sits on top of this muscle over here and part of the other part of the muscles over here. So this slide, you can see 2 arrows. So again, I will outline semitendinosus so you can see where semimembranosus, all right, is being indicated. Right? So the blue is outlining semitendinosus. Okay? Give you a little bit of perspective here too. All right, this muscle right here, this is gracilis, and this is adductor magnus up here. Okay? All right, almost done. We're down in the leg now. A lot to take in. Here we go. Well, we all know this muscle. Gastrocnemius. This is the muscle, that calf muscle that y'all see. Okay? We're going to do a lot of jumping activities. Gastrocnemius is the dynamic, explosive jumping muscle. People that play volleyball, basketball, high jumpers, all right, do a lot of jumping activities, even hockey players, just from skating, right, have very, very defined gastrocnemius muscles. Okay? It's a 2-joint crosser, crosses the ankle joint, and believe it or not, it does across the knee joint. Okay? So it adds some stability to the knee joint. Okay? So if you're ever wanting to increase your stability of your knee joint, do toe raises. Don't forget to hit gastrocnemius. All right. So there's gastrocnemius. Gastrocnemius attaches, right, to the Achilles tendon. You can use that in your response, but that's what the calcaneal tendon is. Calcaneal tendon is your Achilles tendon. And you can probably guess calcaneal, calcaneus, right? It's attaching right here onto your calcaneal bone, or calcaneus. All right. So just deep to that muscle is your soleus muscle. They call it that because they thought that when they first saw that muscle, I shouldn't say when they first saw it. Has anyone ever had sole? Fish. Soleus means fish. Soleus muscle is the muscle that you use in your leg for when you're walking. Okay? Calcaneus, you use calcaneus too, but calcaneus is, or did I say calcaneus? Gastrocnemius is more for jumping. Soleus is more for walking. Right? Soleus is deep. So where gastrocnemius and soleus attach, when they attach onto the Achilles tendon, they call that the triceps surae. I don't know if you've ever heard that before, but in case you have. All right. So let me show you on another model our soleus. Here it is on the lateral view. Okay. Remember what I said? Your thigh has 4 compartments, an anterior, posterior, lateral, and medial. Well, your leg, all right, has 3 compartments. It has an anterior compartment, a posterior compartment, and a lateral compartment. We're going to go and jump into the lateral compartment. There's only 2 muscles that you need to know. All right. This first one here is the fibularis or Peroneus Longus. Either or is fine. I will outline the muscle for you. Okay, has a long tendon down here. Okay, so yes, there is a brevis. So there's fibularis longus or Peroneus longus. Okay, this muscle helps to evert your foot, turn your foot out. Okay, and then brevis is going to be down here. I'll show you, but I just didn't want to have to redraw those blue lines to outline Peroneus longus. Here's brevis down there. Okay, so brevis is closer to the ankle joint. So again, I'm drawing the line to show you Peroneus or fibularis longus. Oops. There you go. All right, so now we're going to go to the anterior compartment where you get shin splints. All right, so these muscles, if you run a lot or when you first started running and your shin was bothering you, it's from this. This muscle here is notorious. Tibialis anterior or anterior tibialis, same thing, right? But again, this is telling you exactly where this muscle is. It's on the front of your tibia. Okay, so it's immediately adjacent to what people like to refer to as the shin. Okay, tibialis anterior helps to invert the foot, and it helps to dorsiflex. I'm sorry, dorsiflex. Okay, that's tibialis anterior. Now what we're going to do is we're going to flip the leg over, and we're going to pull off the soleus. We're going to pull off the gastrocnemius and look at some of the deeper muscles. Right here, you can see tibialis posterior or posterior tibialis. As best as I can draw this, I don't want to insult you guys, but it's kind of right there. Okay, tibialis posterior or posterior tibialis. All right, and then we'll go from the side view here on our medial view, and you can see this muscle that's deep to the soleus. It's called flexor digitorum longus. Yes, there is a brevis. It's on the bottom of your foot, but you don't need to know that for identification purposes. Okay? But you can tell what this muscle does simply from its name. You're going to curl your toes. Flexes the toes. Like John McClane did. You guys know who John McClane is? Die Hard? Hello? You guys remember it's the best Christmas movie ever, first of all. And when he got off the plane in LA, he's taking his shoes off and he's curling his toes on the carpet. So I was like, oh, he's using his flexor digitorum longus. I really thought that. Okay, here we go. All right, next one. Back to the front, to the anterior compartment. Another shin muscle here. All right, that's extensor digitorum longus. It's just lateral, okay, to your tibialis anterior or anterior tibialis. Okay, and again, you can see, yes, there is an extensor digitorum brevis, but again, we don't have to know that for our identification purposes. It extends the toes. It lifts the toes up towards the ceiling. All right, drum roll, last one. Here we go. Easy peasy. Patellar ligament. Or you can call it the quadriceps tendon. Okay? And that's it. You see a little tear kind of roll down my eye because we're done with the muscles. But it's a lot to learn. So I think you folks will be able to handle it. But that's it. Muscles are done. All right. So we don't forget your test is next week. Take the mock exams, all right, as much as you can. I will send out the Quizlets for the remaining material tomorrow night, and make sure you go over those like your life depended on it. Is there any questions from you nice folks at home?